Introduction and preparation. Introduce yourself to the patient. Confirm the patient's identity. Explain the procedure to the patient. Ensure the availability and proper functioning of oxygen equipment. Assessment and monitoring. Assess the patient's respiratory status and need for oxygen therapy. Check the patient's vital signs, including pulse oximetry if available. Assess the patient's comfort level and ability to tolerate the procedure. Monitor the patient's respiratory rate and effort during oxygen administration. Watch for signs of oxygen toxicity or carbon dioxide retention. Equipment. Setup. Select the appropriate oxygen delivery device based on the patient's condition and prescribed therapy. Connect the oxygen tubing to the oxygen source securely. Adjust the flow rate of oxygen according to the prescribed amount. Patient positioning and cannula placement. Ensure the patient is in a comfortable position, typically sitting upright. Position the nasal cannula correctly, ensuring it fits snugly but comfortably in the patient's nostrils. Check for proper alignment and absence of obstructions in the nasal cannula tubing. Administration technique. Administer oxygen using the selected delivery device, e.g., nasal cannula, face mask, or non-rebreather mask. Monitor the oxygen flow rate and adjust as needed based on the patient's response and prescribed therapy. Communication and reassurance. Communicate with the patient throughout the procedure, providing reassurance and support. Encourage the patient to communicate any discomfort or difficulty breathing. Answer any questions the patient may have about the procedure. Documentation and follow-up. Document the procedure in the patient's medical records, including the prescribed oxygen therapy, flow rate, and patient response. Provide any necessary instructions to the patient regarding oxygen therapy at home or follow-up care. Safety and hygiene. Ensure proper infection control practices, including hand hygiene and equipment disinfection. Maintain a safe environment, free from potential hazards such as oxygen leaks or trip hazards from tubing. Completion. Confirm that the oxygen administration procedure is complete. Thank the patient for their cooperation and participation.